Hi, it's Jeff Cohen from the Florida Healthcare Law Firm in Delray Beach. I wanted to talk with you just a few minutes about ACOs, Accountable Care Organizations. In the new healthcare reform era and in that new law, the platform for delivering healthcare is called an ACO. And the concept is that physicians, hospitals, and insurance companies can collaborate, cooperate, and deliver care in a way that brings the expense of it down and drives the quality up. Essentially, you've got those three players: hospitals, insurance companies, and physicians. How they do it is anybody's guess at this point. In fact, there's a lot of demonstration models in play. What an ACO is an organization that's legally organized, could be any number of different forms, which takes on 5,000 insureds, has a 3-year commitment to do so, and does the things that the healthcare reform law is designed to accomplish. Bring costs down, drive quality up. The first phase of compensation to an ACO is going to be in a shared savings model, according to most think tankers. So that means that the insurance company that's partnering, if you will, with physicians and hospitals will have to have an agreement to both track, measure, demonstrate existing expenses and how those expenses are driven down by the organization, the ACO. There's not going to be one ACO in each market. In fact, the government regulators believe and are promoting the concept of multiple ACOs in each marketplace. So the idea and fear that physicians may have that they have to belong to one is erroneous, because that's not what's thought of. The thought is, let's have multiple ACOs. Now, a lot of physicians are asking themselves, should they form an ACO or become part of an ACO? What's the next step? Right now, it's mostly an experimentation time, although ACOs are set to roll out in January 2012, and some players are stepping up to the plate. For example, Mayo Clinic and others that are similarly integrated and have been doing these things for years. Physicians are necessary at the table with anybody that's going to lead the development discussions and the formation. In Florida, most ACO developers or leaders look like integrated hospital systems. They look like hospitals that have medical staffs that are independent and also employed physicians, and perhaps even a contracting arm of independent physicians, for example, a PHO. So those hospital systems are taking a leadership role, but by no means should physicians believe that hospitals can do it without physicians. They can't. So physicians must be at the table. They should understand that an ACO is going to take tremendous organizational expertise, a heck of a lot of capital, and a lot of business sense, and it's going to take a lot of time and patience. Those are things that are in short supply of busy physicians practicing. So in my opinion, it's unlikely that physicians alone are going to jump out in front of business models that are already in place and which have those capabilities. For example, hospital systems. All right, so let's talk a little bit about ACOs. The ACO model is around, if you look at it as a donut, the core of it is supposed to be a primary care core. In other words, primary care physicians are thought to be in the best position to manage health care in an ACO model. That's an extremely debated issue right now, because we have a primary care physician shortage in the state of Florida. We have an expansion of the use of physician assistants, nurse practitioners, and the like. So the reasoning that primary care physicians are available to do that in the intended way and to the extent that it's thought of is a very debated point right now. One of the things we don't see in ACOs is patient accountability. Given some of the insurance changes over the years, where you can't cherry pick and punish, if you will, people that make expensive lifestyle choices like smoking, it's difficult to understand how effective the ACO is going to be without imposing some kind of a financial responsibility on patients that are making expensive lifestyle choices. One of the things that people are not discussing very much but which is understood and implicit in this ACO